Hi, my name is Vicki Alex. I am a nurse in the Heart and Vascular Critical Care Unit here at Bay State. I'm going to go over the importance of blood sugar control after heart surgery. There are a lot of different factors affecting your blood sugar while you're in the hospital, and we might treat your blood sugars differently here than you do at home. This video will give you an overview of diabetes care after heart surgery, and insulin therapy here in the hospital and once you're discharged home. Two of the major types of diabetes are classified as type 1 or type 2. Type 1 diabetes is an autoimmune disease that leads to a person's body producing no insulin. In type 2 diabetes, a person's body becomes resistant to insulin that is produced and starts to produce less insulin than the body needs. Some patients develop high blood sugar after heart surgery, even though they do not have diabetes. Diabetes can cause other health problems, such as heart and vascular disease, kidney disease, nerve damage, and difficulty with wound healing. It is important to work with your doctor to come up with a solution to best manage your diabetes. After surgery, your body goes through a stress response that makes it difficult to control your blood sugar. Keeping your blood sugar in a normal range can help speed up wound healing, prevent infection, and prevent heart attacks or strokes. At Bay State, we usually like patients' blood sugars to be between 70 and 160 after heart surgery. Having a blood sugar in this range might mean an earlier discharge thanks to better healing and recovery. Ways to help manage your blood sugar without adding more medications are eating a healthier diet, getting more exercise, and losing weight if recommended. Losing 7 to 10% of your body weight can lead to an A1C reduction of 0.3 to 2%. Being in the hospital can be difficult on your body's ability to control your blood sugar for a variety of reasons. Your diet may be different in the hospital, you are less active and lying in bed, and may receive medications which can raise your blood sugar level. If your visitors are bringing you food, please discuss the best choices with your healthcare team. We will check your blood sugar levels multiple times during the day and give you insulin as needed. Please wait until your blood sugar has been checked before you start to eat your meals. We also encourage you to drink any recommended nutrition shakes within 2 hours of your meal. Even though you might not be on insulin at home, being on insulin in the hospital may be the preferred way to control your blood sugar. Different medications and the body's stress response after surgery are two factors that can increase your blood sugar. For the first 24 to 48 hours after heart surgery, you will probably be on IV insulin to manage your blood sugar. We like to keep your blood sugars controlled in order to lower your risk of infection, improve wound healing, prevent kidney problems, and shorten your hospital stay. IV insulin works very quickly and will be adjusted based on your blood sugar checks. This is why we have to check your blood sugar so frequently while you're on a continuous infusion. We will be checking your blood sugar before each meal and before bedtime at a minimum. You will likely be on a once daily long-acting insulin and rapid-acting insulin that we give before meals. When you are able to eat, you will be getting injections of rapid-acting insulin before meals based on your blood sugar level. When the IV insulin is no longer needed, you will receive long-acting insulin and short-acting insulin to keep your blood sugar in control. If you are going to be discharged home on insulin for the first time, there are two main things you will become comfortable with very quickly: checking your blood sugar before meals and giving yourself insulin. In order to check your blood sugar, you will need to make sure that you have all of the proper supplies. You will need your glucose meter, testing strips, a lancet, and an alcohol wipe. You will turn the glucose meter on and place the test strip into the glucose meter. Then, you will use the alcohol wipe to clean your finger and use the lancet to prick your finger. Then, you can squeeze your finger to produce a drop of blood and put it on the testing strip. Within several seconds, you will have a blood sugar result. If your finger continues to bleed, you can use gauze to apply pressure or use a Band-Aid until it stops. Please refer to your glucose meter instructions for use. Now we'll talk about how to give yourself insulin. It is important to note which kind of insulin you're administering and how much you should give. Once you have verified the correct dose and type of insulin, you can gather your supplies. You will need an alcohol wipe, the insulin vial, and an insulin syringe. Put the needle of the syringe in the vial, flip upside down, and draw back until you reach the amount of insulin needed. Some patients will go home on an insulin pen. Different pens are available, but many have you remove the cap, clean the tip of the pen with an alcohol wipe, attach pen needle, prime the pen to get out air bubbles, dial the dose, and then inject. Always remember to only use needles once and do not share insulin pens or syringes. Once you have the correct dose and type, you can locate an area on your abdomen with fatty tissue. You will get an alcohol wipe and rub the area that you are about to inject. Next, insert the needle into your skin at a 90-degree angle and depress the plunger of the syringe. If you do not have much fatty tissue, it might be helpful to pinch the skin where you are going to inject the insulin. It is important to rotate injection sites to prevent tissue damage. One of the risks of insulin therapy is low blood sugar or hypoglycemia. This can occur if you take too much insulin, don't eat enough carbohydrates, exercise intensely or for long periods of time, are sick, or your routine is otherwise thrown off. Symptoms of low sugar include shakiness, confusion, and hunger. If your blood sugar drops too low, you are at risk of losing consciousness, having a seizure, or death. This is why it is important to check your blood sugar if you feel any of the above symptoms, and always carry fast-acting carbohydrates with you. Glucose gels and tablets are readily available for purchase to carry with you. High blood sugar or hyperglycemia is also something to try to avoid. Frequent high blood sugar can cause complications such as heart disease, kidney problems, high blood pressure, and nerve damage. In order to lower your chance of these health problems, you should participate in daily exercise, eat a healthy diet, and take your insulin or medications as prescribed by your doctor. If you check your blood sugar and it is extremely high with no explanation, call your doctor. Being sick can drastically affect your blood sugar, especially if you are on insulin therapy. It is important to take insulin like normal, stay hydrated, and continue to eat carbohydrates when you are sick. If your blood sugar is consistently over 225, you should call your doctor to see if you should be taking more of your rapid-acting insulin. You should try to drink at least 3 to 4 ounces of water per hour. If you are unable to stay hydrated or are unable to control your blood sugar, call your doctor to get urgent medical care. Going home on insulin for the first time can be overwhelming. It is important to work closely with your doctor to set individualized goals for your blood sugar. Your doctor will give you prescriptions for testing strips, lancets, and other diabetes testing supplies. To dispose of your insulin syringes and lancets, do not throw them directly in the trash. You should have a sharps container at home. You can check with your town to see if they have a drop-off location for sharps. Some mail-order prescription companies also have programs in which you can mail back used sharps. Insulin therapy can help to better control your blood sugar if other therapies have failed. Your doctor will develop individualized goals and prescribe the correct insulin type and dosages for you. Controlling your blood sugar will prevent long-term diabetes complications, help you heal better from surgery, and help prevent wound infections. If you have questions regarding insulin therapy, ask your doctor.